What is hormone replacement therapy? This is primarily for women, but men have it as well. It's a little bit different, but we're going to specifically talk about women and hormone replacement therapy. When you start as a young girl, you start having periods, your hormones start raging, you start moving toward having a normal period, normal flow. You're ready to have children. Then in your 40s and 50s, sometimes even late 50s and early 60s, you can go through menopause. Ask your mother when she went through menopause. Ask your sister or aunt when they went through menopause. Chances are you're going to do it at the same time. So what is menopause? Just like it says, menopause is your menses has ceased. Specifically, what that means is it's stopped for a year. That's what we call menopause. Before that, it's perimenopause. After that, it's postmenopause. It's all tied together. It's all the same thing. It's the hormones, progesterone, estrogen, and testosterone are starting to slow down in your body, and the traditional hot flashes, skin and hair changes, my hair is losing up, I'm itching, my periods are off, I'm getting some cognitive changes, I'm getting forgetfulness, my fuse might be short. There's a lot of neuro things that happen, cognitive things that happen, your fuse gets shorter, et cetera, et cetera. So how do you deal with that? Great question. And for the last 30 years, I've been putting people on hormone replacement therapy. It started with Suzanne Summers' book way back when. She's got 2 books out now, but way back when, and it made women aware that there's such a thing as hormone control and hormone replacement. There started a women's health initiative, and Women's Health Initiative proved that there's minimal cardiovascular problems that occur. There's a cardiovascular benefit, cardiovascular meaning prevention of stroke and heart attack that kills most of us. You can help prevent that from happening by taking hormones and replacing what your body is being left off. You don't have to have the hot flashes. You don't have to have the skin and hair changes. You don't have to have the vision changes. You can start hormone replacement therapy the instant you start having hot flashes. You go to your doctor, you get sputum, urine, or blood testing done. It shows that your pituitary hormones are starting to rise as a result of your hormones from your ovaries have started to go down. That's the estrogen, progesterone, testosterone. Once it gets to a certain level, you can have that replaced. And we start small and then start ratcheting up from there. It's very simple. If you start having hot flashes, you have the testing done, it's not some of these other things like diabetes or some tumor or some other problem. It is hormone replacement. It is menopause. You can start hormone replacement therapy almost immediately, and you can ratchet it up as your symptoms occur. So what do you mean by that, Dr. Bouvier? Well, what I mean is if you start having hot flashes, you come to me, you rule out the other problems, we can give you a small dose of hormone, estrogen, progesterone, testosterone, maybe one or maybe all 3 of them. Then we ratchet it up from there depending how your body is responding to not just the treatment, but how your menopause is ongoing. So doctor, how do I not have periods for the rest of my life? Well, we can set up the hormone replacement therapy where you don't have periods anymore, but you can get the hot flashes and the other problems taken care of. I heard, doctor, that this is not safe, that it can actually cause heart problems and it can cause stroke and heart attack. No, it doesn't. We proved that with the Women's Health Initiative. In fact, just recently in 2026, they, meaning the federal government, took the black box warning off, stating, okay, now it's okay to take hormone replacement therapy. We knew that 20 years ago. Why do we have a whole generation of doctors not hearing anything good about hormone replacement therapy? Go talk to one of the older doctors and you'll learn about hormone replacement therapy, because it is a good form of therapy for women. Don't overcomplicate it. It's really simple. You can either have hormone replacement therapy that your insurance will pay for, or you can have biohormone replacement therapy for those naturopathic, homeopathic minded people, where it comes from yam or sweet potato that comes from natural sources. You can replace that. Well, doctor, which one do I use? Estrogen, progesterone, testosterone. Check the level, replace what's not there. It's very simple. Biohormone replacement therapy allows you to kind of tailor that a little bit a little bit easier, a little bit better, more person-to-person, one-on-one, but you can still use your insurance to pay for these hormones. You don't have to go to the biohormone replacement therapy. Talk to your doctor. You might even want to talk to your naturopath, because the naturopaths have good treatments that can go along with the hormonal therapy that you get from your osteopath or allopath, MD or DO. But it's simple. It's not complicated. I strongly urge you to live longer and healthier. Go ahead and use the hormone replacement therapy to your greatest advantage. Again, this is Dr. Bouvier. If you have any questions, just submit them to Ask Dr. Bouvier, or go online on the Facebook page, join our newsletter, join us on YouTube, and we'll give you the truth about healthcare. Again, this is Dr. Bouvier.